Good morning, doctors. Welcome again. Today we are going to discuss about temporal arteritis, or we can say giant cell arteritis. This is an inflammation of disease of vessels involving the medium and large arteries of head and scalp, branches of ECA. Most prominently the superior temporal artery involvement. Okay. The main risk factor of temporal arteritis is female patient in 55 years of age. Symptoms includes painful temples, pain on chewing, tender scalp, visual disturbances, diplopia, blurring vision may coexist with polymyalgia rheumatica. About this topic we already discussed. It is a proximal muscle weakness. Okay, and in lab we ordered ESR is raised here, and we need to go for temporal artery biopsy, and the treatment here is high dose of prednisolone to prevent the blindness here, 80 mg prednisolone in a day to prevent blindness. So guys, I hope till here it's very much clear for you. Temporal arteritis, our left is Hanok Sholin, Kawasaki, and Takayasu's. Otherwise, Wagner's polyarteritis nodosa, microscopic polyangiitis, Churg-Strauss syndrome, and about this temporal we already discussed. So, guys, I hope the rheumatology section you like this. So, please go through all the rheumatology topics which I already taught you. So, guys, have a good day. Goodbye, and some are left. I'm soon going to finish. Good day, goodbye. That's all for today. If you have any queries, any question, you can ask me. Thank you.